Hey, Uncle Randy, thanks for joining me to talk about your experience with carpal tunnel syndrome. Could you introduce yourself and explain your history with carpal tunnel?
Yeah, I'm happy to, Max. My name is Randy Lewis. I live in Austin, Texas, where I teach at UT, and I developed carpal tunnel syndrome 2017, right after a period in which I had been working on a laptop computer like 10, 11 hours a day, and I was traveling, and all of a sudden I was like, my fingers are starting to ache a little bit in the nighttime, and that's often a clue that it could be carpal tunnel. It's the nighttime pain, and I thought it would just go away. But it just instead got worse and worse until, so I tried. I can tell you the things that I tried to relieve it, but let me know what you want.
We'll get there eventually. So I want to first just explain what carpal tunnel is. It's when the median nerve becomes compressed as it passes through the space on the hand. And this is surrounded by the carpal bones here on the wrist and then the transverse carpal ligament here. And that's why it's called the carpal tunnel. And so this median nerve travels up the palm to the first four fingers here. And that's why when it becomes compressed, it can cause pain and numbness in this area. So one of the hallmark signs there is going to be pain increased at night. Can you describe some more of the symptoms that you experienced and how they affected your life?
Yeah, it was an ache that was sometimes like switched into almost like an electric shock kind of pain. So a really terrible sort of pain where you're distracted all the time by it. You can't really enjoy life. So even if it's not hurting constantly, the fact that it's hurting like a kind of throb throughout the day and then through much of the night, it keeps you from sleeping, and you start to suffer from sleep deprivation. And so it has an enormous toll on your quality of life.
Yes, and I know one of your big hobbies is playing piano and guitar. Can you describe how carpal tunnel affected your ability to do that?
Yeah, they shut it down entirely. It was sometimes painful, and I was paranoid about doing anything that I thought could aggravate my symptoms, so I just stopped all that. And then I got surgery to see if that would help.
I'm going to get to surgery in a minute. I want to talk about the causes. There's no one definite cause. It's just some risk factors that we know are involved in it. So the first thing is any changes in the bone, which can happen due to an injury maybe, and that can cause a narrowing of the carpal tunnel. And then the other main cause that we know is inflammation, and that can happen due to repetitive hand movements, which you talked about with your typing, right? Yeah. And so next I want to talk about the treatment. And the first thing you want to look at is the non-invasive options that you have, and that's going to be physical therapy. So physical therapy treatment for carpal tunnel is going to be aimed at managing the pain and the swelling and helping to improve your circulation. And then stretching can be applied to reduce the tension in that wrist, and that might help to release some of the pressure of the median nerve. And then also a big thing is just keeping up with strengthening exercises, and stronger wrist and hand muscles are going to help to reduce the risk of developing carpal tunnel again. And I think these skills are very relevant to the profession of the PTA because this is a very common pathology, and it will help us address the needs of a large patient population. So can you tell me a little bit about your experience with PT?
Yes, so I went to several different PTs over the years to get different kinds of nerve glide exercises.
Yes.
Some strengthening stuff. I wish they'd given me more strengthening. My personal experience is that strengthening helps my body more than any kind of stretch or nerve glide does, but that's just my own unique experience. And eventually, I wasn't making any progress, so then I went to a hand surgeon.
Mm-hmm. Yeah, and so that's the next step is surgery. And the surgery they do is called the carpal tunnel release. And this is an outpatient surgery where the surgeon will cut the transverse carpal ligament, and that's going to relieve that pressure on the median nerve. Could you describe your experience post-surgery on the recovery process and the management techniques that you used moving forward?
Yeah, I mean, for management, the surgery, like some people will tell you that it's not a big deal, and I guess it's not compared to major surgeries, but it's still really, you can't use that hand very much for a couple of months. So it's really limiting, and it's surprisingly painful for the first at least week or two. So, you're loading up on Tylenol and things like that to try to get through. And the hand's immobilized in splint for the first, I guess, 2 weeks or something.
And so how are you doing today? Are you relieved of all your pain from the carpal tunnel, or is this an ongoing pathology that you have to manage?
I am in a really good shape with it now. This is one reason why I like PTs more than MDs. Is the PT world is very hands-on and investigates the body. Nowadays, doctors don't have the time or interest to do that, and so they performed a surgery that I probably didn't need because the real source of the problem is posture and curling over my laptop and things like that. So as I've maintained better posture and core strength to do that, and more ergonomical setups for my workstation, that's made a huge difference.
Excellent. Well, all right, that's all I have for you today, Uncle Randy. Thanks so much for sharing your experience on carpal tunnel syndrome.
Happy to do it.